Dear colleagues, we continue our work, and the topic of the next event is transfer medical equipment to pediatric hospitals of Ukraine and announcing of the 12th charity campaign Heart to Heart. Our guests are Bogdan Ishchuk, chairman of All-Ukrainian Charitable Foundation Heart to Heart, and Sergiy Rykov, chief doctor of Kyiv Clinical Ophthalmologic Hospital, Microsurgery Center, head of ophthalmology unit of Kyiv Medical Academy, of P.L.Shupik Kyiv Academy of Postgraduate Education. He is also president of the Association of Children's Ophthalmologists of Ukraine. And we also expect Volodymyr Zhovnir, chief physician of the Scientific and Practical Medical Center of Pediatric Cardiology and Surgery at the Ministry of Healthcare of Ukraine, and Eugenia Baranska, member of the Supervisory Board of All-Ukrainian Charitable Foundation. And first I give the floor to Bogdan. Thank you for opportunity to be here, not for the first time, and today we will be talking about campaign Heart to Heart in 2016. Today it is not only St. Valentine's Day, but also a very important day for our foundation, because we are holding press conferences with reports in all regions of Ukraine. For 11th year now, we have such tradition to report about every our campaign in order to ensure trust to our foundation, for that people could understand that they can give donations for children's hospitals, and that they are able to check how this equipment has been procured and how it is used. In 2014-2015, we were raising money to procure equipment for emergency departments, and now we raised 3,176,000, and we procured medical equipment that has already been passed to hospitals in the regions and in the cities. And each volunteer who participated, every activist, every journalist can come to these hospitals and to see how it is used. The aim of our campaign in 2015-2016, our aim was a reanimation department, and we raised this amount of money. We procured 53 perfusers and passed them to reanimation departments, as well as 8 monitors, 13 exafillators, and 11 units of additional equipment. The full list is available at our official website, and also in every hospital, because each reanimation department has certificates allowing them to use this equipment. During the previous press conference, we summarized the results of our previous campaign, and we thank to everyone who participated. We achieved a fantastic result because we raised 1 million more than in 2015, despite economic hardship and all the difficulties, because sometimes there are more urgent issues in our country. What about the last campaign? We can say that it is over because equipment has been procured and installed, and the list can be found at the website or directly in the hospitals. Now I'll be talking about the next campaign. It will take place between the 9th of March and the mid of April. It will be related to procurement of equipment for ophthalmologic departments. I will give you more details about organization of this campaign. And now I give the floor to my colleague to say why it is so important. First of all, I would like to thank to volunteers, as the campaign takes place for the 12th year now, and various types of hospitals department receive various equipment. It is very good because It will stay there for many, many months, many years. And I'm very glad that the youth has an initiative to organize one more campaign, because during the years when we organized such campaigns, we reduced the number of blind children in Ukraine almost twice. The world organizations say that the number of blind children with vision impairments should be reduced in 2 times up to 2020. And this campaign will help us to improve equipment in pediatric hospitals, in order that we could make diagnoses and prevent such diseases on time. We had a meeting of directors of regional associations of pediatric ophthalmologists, and we understand that a lot depends on volunteers of the civil society. We should work in partnership. Just imagine, in 2005, we had nearly 12,000 blind children. Can you imagine this? They are all with this disability. And we have nearly 7,000 today. And this is because of the fact that we have this contemporary equipment allowing us good diagnosis. And eastern regions, I mean Donetsk and Lugansk regions, said that we should not treat them as poor regions, and they said that they want to participate in the campaign and to give donations for this equipment, to procure it for Donetsk and Lugansk regions as well, because as you know, everything, almost everything has left in the occupied territories. We are waiting for this campaign, and we want to raise more money than for cardiology, because every year we have to show our activity, and we will try hard to do it. Yes. And now let's start the presentation about our campaign. This is polygraphic materials, because we want to make all this campaign attractive, and to talk about it not with tears in our eyes but with smiles, because we are helping children. This 12th campaign is targeted on children with vision impairments, and that's why we are using slogans that say that children after treatment will be able to see a colorful world. Traditionally, each volunteer who participates in the campaign has the identificator. Here is the one side. There is a place for the photo. Could you return this picture? Thank you. There is a number of volunteer, his name and surname, and place of residence. All this data allows to identify where the money is raised. And we use a quotation of Mahatma Gandhi that every organization should should ensure that the society trusts them, and donations are the best proof that it is so. In the previous year, we had increase in donations, and I hope there will be the same in this year. On the opposite side of these volunteers' identification paper, there is information for volunteers about general terms of the campaign, what volunteers should have on them in order to be a volunteer, because nowadays we often meet the facts that someone is raising money on behalf of our organization. And it is illegal, in fact, because that's why we decided to make a very clear distinction signs for our volunteers. And now we'll talk more about our boxes for raising money. As you can see, it is colorful, it is made like a vitrage, and it contains the main information about the campaign. The number of volunteers should be indicated on this box, and it must be the same as the volunteer's identification number who goes with this box. It is very important. Let's see the next slide. This is a sample of our Thanksgiving certificate, because each volunteer work without being paid. It is their personal enthusiasm, and we award them for this. And one more important thing, this is the small heart, a symbol of our heart to heart. For each small donation, every person who donated receives this small heart as a symbol that he or she participated in the campaign. I would like to add that on April the 9th, there will be a final day of the campaign, and you will be able to see volunteers right in the streets of your cities, and to give them your donation right on the streets. The main updates will be published on our website, and every person can participate in this campaign online and donate online. This is general information about our campaign, on our upcoming campaign. Less than 1 month is left, and rather soon you will be able to see all these advertisement in your cities, and I hope you will participate, because it is our ability with joint efforts to help children who need this help. Thank you, colleagues. Unfortunately, Mr. Volodymyr and Ms. Eugenia did not come yet. I'm not sure they will be able to come on time. Dear colleagues, the journalists, do you have any questions to our speakers? If there is no questions, it is clear. Maybe would you like to add final remarks? Not in fact. I would like to say only that I hope that the 17th campaign will be successful, and we will find a final solution to this problem of blindness among children, because it is very important for many children who have been born with such disabilities. Thank you, dear colleagues. We will finish here. The next event will